I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. Please do subscribe my channel as well as press bell icon button. You will receive all my latest videos. Today, I'm going to talk about congenital infections. Infections which are acquired during the pregnancy as well as during the birth, during the delivery from the birth canal. The incidence of congenital infections is decreasing nowadays. There are several reasons because of the more awareness of the infections during the pregnancy and their consequences, which are usually unpleasant and long lasting on newborns. More testing, better testing methods, new treatments, preventive methods, as well as educational sessions to the pregnant ladies. In this session, in this first vlog, I will talk about two infections. So the one is toxoplasmosis, as the other one is syphilis. So whenever any pregnant lady gets infected with any infection, then this infection is passed to fetus or newborn through the placenta, which usually result in fetal loss, the emergence of congenital malformations, prematurity, or chronic postnatal infections. Maternal illness is usually mild, but the consequences to the fetus are usually severe. The transplacental spread of the causative organisms of infection pass to the fetus, and these infections usually result in chronic infections. The main reason is because the immune system of fetus is immature. So this immature immune system cannot fight properly with the microorganisms. So the consequences are usually unpleasant. So what is toxoplasmosis? Toxoplasmosis is an infection caused by a protozoa, which is called as Toxoplasma gondii, so which is transmitted from the infected mother to the developing fetus through the placenta. This organism is acquired by exposure to the contaminated feces or by eating raw meat. So this infection is usually unrecognized at birth, and pregnant women are not routinely uh, screened for toxoplasmosis. So clinical consequences of congenital toxoplasmosis are usually present in most infected individual by early childhood. So what are the signs and symptoms of toxoplasmosis? The most common feature is chorioretinitis, which can lead to blindness, obstructive hydrocephalus, intracranial calcification. Mental retardation is very common. So infected children also suffer with fits, and their motor system is not fully developed, so it's usually defected. Early detection is very important, not only to treat the pregnant mother as well as to prevent the congenital infection in the newborn. Polymerase chain reaction, a most latest molecular method which is done on the amniotic fluid. If this test is positive, then treatment is given to the mother which is usually spiramycin 1.5 gram 2 times a day, or alternate is pyrimethamine sulfadiazine plus folinic acid. So usually this one is given for 10 days. In toxoplasmosis, intrauterine growth is usually restricted. That's why ultrasonography is done to check fetal hydrocephalus, whether there are any intracranial calcification or ascites. So how toxoplasmosis is prevented? So avoidance of undercooked or uncooked meat, as well as avoidance from the cat. So somebody else should clear the cat feces, not the pregnant mother. So let's talk about syphilis. Syphilis in pregnant ladies, as well as syphilis as a congenital infection. An infected pregnant lady pass this infection to the fetus. Syphilis is caused by Treponema pallidum. Syphilis has three stages. So the first one is a primary stage, is characterized by the presence of syphilitic chancre and lymphadenitis. The second stage is characterized by the hematogenous spread or spread of the organism through the blood to the infant and then cause congenital syphilis. These infants can then go into the latent asymptomatic stage or a symptomatic tertiary stage. So the third stage is a symptomatic tertiary stage of congenital syphilis. This is characterized by neurological as well as cardiovascular. So brain and heart both are involved in this stage. Incidence of syphilis in newborn is nowadays it is very low because of the mandatory testing of the syphilis in all pregnant ladies. So what are the common signs and symptoms of congenital syphilis? Congenital syphilis can be symptomatic before the age of 2 years. So early disease or the symptoms might emerge after 2 years. That is called as a late disease. Without effective treatment, perinatal death occurs in 1/3 of the cases. The remaining 2/3 are usually asymptomatic, but if left untreated, symptoms will emerge within the first few months of life. In early syphilis, the common signs and symptoms are blood through the nasal secretions, spleen as well as liver are enlarged, newborn are usually jaundiced, their liver functions are disturbed, they suffer with anemia, osteochondritis, and their bloods are also not normal. So the platelets are usually low. Red spots on their skin. The growth is not optimal. They also suffer with kidney problems, blindness due to the infection, syphilis infection in the eyes. Their nervous system is involved, and that is usually not fully developed, and there are abnormalities. So in late features, what we normally see, chronic inflammation of the bones, teeth, and nervous system is not like a normal baby's nervous system. So how the syphilis is confirmed, the diagnosis is confirmed? There are several tests. So one is a dark field microscopy. So that is done. There are serological testing as well. For example, venereal disease research laboratory test and rapid plasma reagent test. So there are some specific tests as well, like a Treponema pallidum immobilization test. So once these tests are confirmed, then treatment is given to treat mother as well as to treat newborn. The most effective therapy even today is penicillin. So either penicillin G is given or benzyl penicillin is given. So both are good and very effective. So what are the early findings? As I mentioned earlier, both liver and spleens are enlarged. There are spots on the body, rhinitis, notched teeth, hearing loss, saddle nose, saber shins, developmental delay. Thank you very much for watching this video. If you have any question, please write down in the comments so I will answer your query. Thank you.